Hey everyone, welcome to my podcast. And I can't wait to introduce Dr. David Shirazi with me today. That's amazing.
Mhm.
Thank you very much for coming and joining me today.
Oh, it's my sincere pleasure. This is very exciting for me.
I would probably just explain a little bit why I have you here because I was really excited about what you do, what you
Mhm.
study, and what is your research about. And I also would like to know more about your background. I don't want to go there because I know you have so many doctorates and masters of science. I know you study the traditional Chinese medicine. I know there
Mhm.
is master of arts of psychology. So many things that I read about you, and I was like, okay, probably I'm not the
Mhm.
person to talk about it because your background is amazing and it's absolutely impressive.
Mhm.
And that's why I'm so happy you actually are spending time with us today because I think you will
Mhm.
give us a lot of answers and a lot of topics that we can talk about around sleep, around psychology, around Chinese medicine. You know, when we have any pain or any disease or yeah, any problems, I think that will be great. Thank you very much. And
Mhm.
I will probably ask you to tell us something about you, about your background, anything that you would like us to know. Thanks.
Okay. Whatever you'd like. Yeah. So what would you like? Where
Everything.
would you like to begin? Not
Okay,
enough time for that, but
let's ask like wow, like you have to have like thousands of hours of study. Like let's
yeah.
start there. Like
Yeah,
like you
you could say that. Well,
like
so after college, I went to dental school. My mom's a dentist. I was a dental assistant from the age of 14. So at 22, I went off to dental school. I loved it. And just so you know, 4 years of dental school is equivalent to 10 years of your life passing. It's so dense with information. That should be worth 10 hours of data, not four. And then when I came out, I felt like I needed to learn so much more just to be a dentist. So I came out, I was doing about 200 hours a year of continuing education in all aspects of dentistry, like surgery, root canals, orthodontics mostly, and as it turned out, TMJ and sleep therapy. And
it's
I was
interesting.
just, yeah. And so I graduated in 2000. And then as soon as I graduated, I took my boards. And then January 2001, started the Chinese medicine. Yeah.
That's being
And
different, yeah. Like from dentist to Chinese medicine. That was
yeah,
what was attracting you.
I have to tell you this in all honesty. Every single one of my degrees and my accomplishments and everything I do is for purely selfish reasons.
Okay. Thank you for your honesty. Let's go
Yeah.
there.
So, like with dentistry, I enjoy working with my hands. I enjoy a lot helping people and communicating with them, like, finding some common ground.
Yeah.
So, the dentistry was a no brainer. My mom inspired me. So, it's very easy. And then the Chinese medicine, I actually had no intention to practice it. What I wanted to do was when I had my own family, I wasn't married yet. When I had my own family, I wanted to treat them in a more holistic way. When I was 18, I had a cold, right? And my mom, being a neurotic Jewish Persian woman, said, "Oh, go to the doctor," right? So I go to the doctor, and the waiting room is full of people hacking and coughing, and I just had a little cold. So
Very
I went,
normal.
right? So I went home. I came back an hour later, and they took me in, and they're like, okay, here's some antibiotics. I said, well, okay. Everyone in my family is a doctor or dentist. So I had a little bit of knowledge, little bit. So I just asked, I said, because I knew that um, a rhinovirus meant the nose. So I said, well, there's problems in my nose, right? He goes, yeah. I go, it's a virus, right? He goes, yeah. I go, well, what's the antibiotic going to do for a virus?
Yeah.
And he goes, well, the antibiotic will focus on the bacteria in your immune system so that your immune system can focus on the virus. I'm like, okay, I don't know any different. So I tell my mom, she's a dentist.
Wow.
She's like, yeah, you got to do it. If the doctor told you to do it, you have to do it. That's
Yeah.
that. I'm dating her now, but that's kind of the genre. And so I took it. I got better. And that was before internet. So I went to the library, looked up the research. And even back then, this is like 1991, even back then, we knew that you don't give antibiotics for viral disease. One,
Absolutely.
for no other reason. other, then you could develop a resistance to it, and it won't work for you when you really need it. That was
Yeah.
one of the reasons. So I had made a decision then that when I got out of dental school, I wanted to be a dentist since I was 14. I decided that when I got out of dental school, I would learn something holistic that I could then, use for my family. And when I was doing martial arts, when I was 21, my teacher when he was in the army, he was a dental technician, and he kept telling me about Chinese medicine. He kept telling me about Chinese medicine
Yeah.
as it relates to martial arts and the internal and the external work. And I had called the oldest accredited acupuncture school in America is called SAMRA, and I called the school up, and the secretary gave me the dean right away. And I said, "Oh, well, okay." And the dean was like, "Yes, whatever you like, come. I'll give you a private tour and tell you everything." I said, "Okay." So as soon as I finished dental school, I went and studied Chinese medicine, and it's very interesting. Obviously, I like learning. Um, and again, I need to point this out. I wasn't married, so I had a lot of free time to
Yeah.
travel, learn things, go away for the weekend anytime I wanted. It was great. It's still great. And then at the time that I was in the clinic in acupuncture school, we're doing acupuncture, and at the same time, I'm doing orthodontics, and we're resolving these children's headaches and migraines and sleep apnea. We didn't really know it was sleep apnea. We just knew they were getting better sleep. And I said, "Oh, this is great. I'm going to do this to adults." And I did it to adults, and I was having pretty good success. And then I started applying the acupuncture with the adults, and it was fantastic. I said, I could do this for a living. you know. So that's when I decided, when I got my acupuncture license, to limit my practice to pain, sleep, and orthodontics. And
Yeah.
we actually have centers. We actually have centers in Australia, including Perth, where you are.
Awesome.
Yeah. And
Yeah.
one of our centers is actually studying to become an acupuncturist as well.
Oh, that's great. That's
Yeah,
awesome. I
I
will have
think
to
he's in
connect.
Sydney. I think he's
Okay.
in Sydney though. But yeah, wonderful guy.
Yeah. Awesome. If you will have anyone in Perth, let me know. Yeah, I would love to connect with them. And
Absolutely.
yeah, I would like to probably touch base on that what you said, because you said, oh, so many great points. The first thing, I had the same experience. I actually didn't go to doctor when mom sent me, because I realized they always just give me the antibiotics. And I was like, I don't want any more antibiotics because it's silly. Like, I don't want to have them because they are not actually for flu. And every time when
Yeah.
you just feel a little bit sick, you're going straight away to doctor and you always get the antibiotics. And actually, if I didn't stop that, I will probably antibiotics are never going to work on me, because I will be having
Mm.
probably every year a few
Every
times.
year you need
Yeah.
antibiotics for a new
And I
sickness.
was
Yeah.
like, yeah, I just kind of stopped going to doctor just because of that.
Mhm.
And I really lost the trust in doctors, because and I don't know, I was kind of taking that with me. It was kind of sad, because I had really bad luck like for a while, and it cost me things like I can't have kids anymore, and it cost me a lot of stuff
Mm.
just because of doctors, and they didn't realize what's wrong with me, didn't know what's wrong with me for a year.
Mhm. Mhm.
It was very, for me, that was big fight. And that's why it's more like I'm inclining into that Chinese medicine, because I believe in that. I believe
Mhm.
there are so many things we can heal. It's coming from nature. It's coming from old learnings,
Yeah.
and it's just so amazing. And I love when people study that, because it's really helpful. I know that Chinese medicine always helped, and everyone I know, they always come like, oh my gosh, I was with this doctor, that naturopath or Chinese medicine doctor, right? It was awesome. Like, they helped me with herbs. They helped me to change something in my food, or the way how I'm exercising or doing things. It's always great result. That means I absolutely can't wait to talk more about that. And it's funny how naturally, like, you're like, yeah, I want to help people more. And I guess that's why maybe you were attracted to that Chinese medicine, because you realize you can help even
Yeah.
more than dentist. Yeah, that was probably the
Yeah.
main.
There's a fundamental layer. Like, there's so many things that are, like everyone is a web. Everyone is they have so many layers. So we've got the physical, we got the physiological, we got the airway, the neurological, the emotional, the genetic, the ancestral, the dietary, the gut flora. There's so many levels and layers to every person. And it's such an interesting challenge to try to find out what each person's priority level is, and then
Yeah.
try to, because appliances aren't going to do, because we use appliances to do ortho or to treat sleep apnea or to treat TMJ problems, but they don't always fix the problem. I have to refer out as well.
Yeah.
I need help.
Absolutely. Yeah. Okay. And that was interesting. You mentioned that you did martial arts, and it's so funny how you always see the martial arts. Who is teaching martial arts is usually an army or ex-army. It's very great connection. It's kind of always the same. And what did you do? Like what type of martial arts?
I studied Shaolin.
Oh,
You
interesting.
must have heard of it, right? It's an ancient
Yeah.
Chinese system. Um, and one of the things I liked about it is what they have. They have what's called the external and the internal. So you do the external, like the movements, the positions, and you do the internal, which is the breathing,
Yeah.
right? And it's for your focus, and it's for using your body and your gravity, and for just generating your own energy.
Yeah, and that was something that I would love to talk about, but I'm not sure if the breathing is before or after, but it's more, I would like to go a little bit deeper into that sleeping study that you run, because I know it's something big in your life right now, and I
Yeah.
know you do a lot of stuff around that. Let's talk about that, and maybe what is why sleeping? Why sleeping study? Why did you choose to do that and actually continue that journey?
Hmm.
and and we will dive into maybe some benefits or something that is important and
Okay.
how that is influencing our life.
Yeah. So this the sleep part was actually it was very weird. Um, you
You
know,
couldn't sleep, yeah?
no, no. First, I was first a TMJ expert before I became a sleep apnea expert, and now we know that 50% of the time, the reason why we clench our teeth at night is
Mm.
because of some form of sleep apnea called upper airway resistance syndrome. But I don't think I knew that then. And but I had taken all the sleep apnea courses for dentists already, and you know, they were so remedial. They were after you've taken a couple, after you take like 3, 4, 5, they're all the same. They don't have anything new.
Yeah.
And the medical ones were very much pill, pharmaceutical driven, CPAP driven, or surgical driven. There was never any um, desire to fix the problem. It was just sort of, well, this is the treatment we have. And to be honest, CPAP is sort of fixing the problem in real time. You just, it's not something that half the people want to stick with. So I was taking courses that were designed for sleep technologists. Sleep technologists are the ones that do the sleep study. The ones where you go into the
Yeah.
lab and you have the leads and the nasal and the thermistor and all that.
Yeah.
And I was taking all these courses and I was really enjoying it because these guys are like legends. They're jotting down data from 20 different leads in real time, and when they're doing like a CPAP titration, they're actually fiddling with the CPAP machine while they're monitoring the patient in real time. So these guys are amazing, right?
Yeah. Wow.
And I was learning so much great, useful information in these courses. And the guy who's now the president of the BRPT came up to me and goes, "Oh, so you want to be a sleep technologist?" I said, "No, no, no. I just want to like learn this information." He goes, I go, well, I'd be open to becoming a sleep technologist. He goes, "Okay, well, you'll be our first dentist if you become one." I go, "Okay, great." And he goes, "So you also want to open up your own sleep lab, right?" I said, "No, I don't have any desire to open up a sleep lab." And he goes, "Are you sure? Are you sure you don't want to open up your own sleep lab?" I was like, "Well," I even asked him. I go, "Are you soliciting me?" So I remember it was my birthday. I was flying home and I was thinking to myself, so I always referred out as all dentists do for a sleep study, whether in-home study or an in-lab.
Yeah.
And we do know that half the people that are given CPAP give up on it. Okay. And I was noticing that for every 10 patients I was sending out, I was getting one back. Right. And the one wasn't out of the 10, it was some other patient. Right.
Okay.
And I would tell them, like, why aren't you guys sending me your CPAP failures? That's in your guidelines. If they can't tolerate the CPAP, the next best thing for mild to moderate cases are oral appliances. And they're like, oh no, we have like a 99.9% success rate. I go, with the CPAP. I'm like, listen, your patients are coming to me on their own. I go, maybe they're too afraid to tell you to your face. Okay. But even though the CPAP works, and it works better with an oral appliances, it's just not tolerated as well. The example I give is the difference between ointment and suppository, right? A suppository medication works much better than a topical cream, right?
Yeah.
But who wants to do a suppository every night up there? And
Yeah.
who would rather just put on a cream, right? And if you're getting 80% of the results of the suppository, then I'll do the topical cream, just so I don't have to do, just so I don't have to do the CPAP. So I was thinking to myself, so I'm referring all these people away, and I'm not getting them back. It's not a very reciprocal sort of thing. But my passion was research. So I built the sleep lab. When I built out my new office, is 8 years ago now, I built out a new sleep lab in addition. And we were very lucky. We got a great research study where we're testing insomnia with the medication, and it was great. And I got to be the one to just test it for them. It was a multi-center study, and I really just loved being a principal investigator. I loved being the research aspect of it, and I was for 5 years being a sleep technologist. I was able to kind of speak both sides of the coin. So if I had a physician that didn't understand what I was doing, I would explain to him using his language
Yeah. That's
on how
important.
we can combine the work together. And when I teach dentists, I teach them about that side of it and the importance of what they do. And like, for example, there's a lot of dentists. We have this thing called a home sleep study that you wear in your own bed, and
Yeah.
and then we give it to a physician to interpret. So there's a lot of dentists that treat sleep apnea, and they want to be able to diagnose sleep apnea using that home sleep study, right? And I'm the first one to tell them no. Okay. I go, you don't have the credentials, you don't have the training. Even as a diplomat in sleep, as we are, we don't have the training on how to read or interpret a sleep study as it relates to the patient's medical history. Okay. Patient could have an iron deficiency, patient could have narcolepsy, they could have insomnia. These are things that are not going to get picked up on a sleep study. And that person needs to know, say, okay, well, this in-home study is not enough. I think you've got a more centrally mediated problem or physiological problem. I need to send you for an in-lab study, and I need to send you to a doctor that's going to manage your care, right? And I'm sorry, 100% of dentists don't have that training. 99.9% of dentists
Yeah.
don't have that training. So it's like, it would be nice, it would make things more convenient, but that doesn't mean that's what's right for the patient.
Yeah. And I
Yeah.
know you mentioned that that is connection, like when you grind the teeth. Like, is
Mm-hmm.
that what is that? Like, is there any cause that you know, or it's very
Yeah.
individual?
So we have, well, it's always every individual, but we have multiple studies now, I think 3 at least, 4, where while we're doing a sleep study on the patient, okay, half the time, 50% of the patients that clench their teeth,
Hmm.
we see their airflow going down. And so they're doing what's called shallow breathing, like
Okay.
almost like snoring. We call it upper airway resistance. And then when the airflow goes down, then we see the clenching activity of our masseters going up, and the people clench their teeth. And presumably, when we clench our teeth, we clench like this, and it tightens up our throat muscles and our tongue, right? And then when we see with the clenching muscles up, when the airway is normal again, then we stop clenching.
Okay, that's interesting.
So when we
Okay.
look at anybody, now the other 50% of the time, we see people clenching their teeth and the airflow is doing nothing synchronistically with the clenching. So
Okay.
we always use the word stress, right?
Mm.
So stress means, in my understanding in this context, is anything that causes an autonomic nervous system disturbance, right?
Mm-hmm.
So if you have emotional stress, right, someone cuts you off on the freeway, you can come home and clench your teeth if you're upset by that, right? In the last year, the whole world has had a good reason to clench their teeth. It's been stressful for everybody. But in addition, if you have, for example, a gluten or dairy sensitivity, food sensitivity, and you have a slice of pizza before you go to sleep, you're going to clench your teeth probably.
That's amazing. I just,
Yeah.
I think it's so great to talk about that just because my partner is doing that something or he has sometimes and he has problem with sleep. Like I know it's a lot connected with actually food. Like he can't be hungry, he can't sleep when he's hungry. I'm not sure if he's just telling that to himself because I said again, just being hungry, like it's better to have less food before the night, like to have a lot of food. I
It
don't know what is your
it
opinion. Okay,
depends. And
yeah,
that the answer to that is it depends, right?
also,
So it depends how much ketones they have in their body. It depends how many carbs they eat, and what their body has fat adapted and insulin adapted to. So, for example, for a lot of some people actually need calories to sustain them through the night. Okay, but you won't get that eating a pizza. Okay, you'll
yeah.
get that eating a highly fatty food
Okay.
like nuts, butter, coconut, things like that, because it takes your body so long to degrade the fat into either a ketone or into like sugar, into glucose.
Yeah, yeah.
So that degrading process will carry on through the night, right?
Okay, absolutely.
Whereas
That
if
makes
you have
sense.
sugar,
Yep.
if you have like a cup of yogurt, which today is mostly sugar, if you have that and you think you're healthy, but you're not,
It
okay,
is not, yeah.
right? But some of them are good. If you're having a raw goat
Like,
yogurt made from like the milk
yeah,
fat, then that's probably going to
like
be okay for
real
most people.
milk. Yes, exactly.
Real
Real
like
milk.
goat's milk, right?
Yeah.
Particularly, or brown cow milk. Um, what we'll find if you're having just regular old yogurt, what ends up happening is your brain has enough glucose, but then your body burns through it so fast, halfway through the night, you wake up and you don't even know you're hungry. You just wake up,
Yes,
right?
absolutely.
So some people actually do need calories through the night, but it's best if those calories are 100% uh, ketogenic, meaning mostly fat
Yeah, but
and some protein. So nuts are great. Like macadamia nuts are great. Even pecans are great. Buttery food, if you don't have an allergy to it, is great.
yeah, that's very interesting. And that's actually great. That's probably very important information that can help me right now. And yeah, with sleeping, let's talk about a little bit of benefits because I know it's connected also with breathing. You mentioned something about breathing techniques and sleeping. Is there anything, any study you do around that, or how breathing can probably calm us down? Because I'm doing a lot of meditation, a lot of yoga, and I'm really like I love breathing techniques and I think they're really
Hmm.
useful. And is there anything in your study that you can actually like help us to understand
Yeah.
better? Yeah.
So there's a few studies. So meditation on its own, I haven't found that to be beneficial for sleep apnea yet. Maybe I find it one day. I don't know.
Yeah.
But we do know there is a technique called myofunctional therapy, where you train your tongue to swallow properly with the tongue on the roof of the mouth. And when you can do that, assuming you don't have a tongue tie, when you can do that, it brings your mandible and tongue forward, which opens up your airway. We see that as a reduction in sleep apnea. If it's done properly, we see that a reduction in sleep apnea at 50%.
Wow. Okay.
There's been 3 studies that I know of on didgeridoos from Australia,
Okay.
um, because it is a special kind of wind instrument, right? As you know,
Yeah.
with the didgeridoo, you inhale through the nose, you keep
And
the
you
air, right? And you do a circular breathing. So you inhale while you're blowing out, right? Now, if you think about that, and it's very hard, by the way, very, very hard. When you do that, it makes your tissues very taut. Okay. So I should explain. So sleep apnea, for the most part, is a disease of loss of neuromuscular tone. Okay, for the most part. Obviously, if you've got huge tonsils, you can't breathe through your nose,
Yeah.
you're extremely fat and your airway is this big, yeah, that's obstructive too. But ultimately, it's neuromuscular tone. So, and what I mean by that is if you see someone that works out at the gym a lot, and when they're at rest, you can see all their muscles and they're not flexing, you just see their
Yeah.
muscles. That person, we say, has a strong neuromuscular resting tone. Okay.
Yeah.
And those that are very flabby, even though they could be strong, they're very flabby tone. Those are the people, when it's the upper pharyngeal muscles, those are the people that will have sleep apnea.
Okay, that's interesting. Wow, I never
Right?
connected that. Yeah, yeah, understand.
Yeah. But you have to understand, we have 4 points of occlusion. We've got in the middle of our nose. We've got the entrance of our nose, the turbinate space, the back of the throat, soft palate area, and the back of the tongue and infrapharyngeal way. So we have areas that can occlude, like let's say if you have, like, for example, a dairy allergy, that could give you a stuffy nose.
Yeah.
And then you're switching to mouth breathing, which then postures your jaw backwards, which is bad for your airway. So it's a dynamic thing. But keeping neuromuscular tone by learning to swallow with, like, this myofunctional technique, using the spot, is effective. Didgeridoo use reduces sleep apnea by 50%.
That's
So
pretty big number. That's pretty good.
50%
Yeah.
significant. 50%.
Yeah.
That's the same number improvement as surgery.
Wow. Okay. Yeah.
Okay.
I'm going
So
to probably use the Didgeridoo.
yeah. So assuming your surgery is the correct surgery, right? Then we find that nasal surgery will reduce sleep apnea when it's causative about 50%.
Yeah. Okay. I love that. Like I love, like, we can exercise now. We can probably try to do some exercise with our tongue and breathing. I think that's very important. Also the
Mhm.
food. I love when you mentioned that is great for some people to have oily oils and oily food that really just don't have a lot of pizza carbs, and like you said, that's something that we
Yeah.
really we digest, we break it down, and we are hungry afterwards, even more
Do,
hungry.
do
And
you guys have avocados in Australia?
yeah,
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 you
sure.
do. Avo. You call it like
Perfect. Avo, yeah.
avo and toast, right? Of course you do. So, and you're very sunny. So yeah, avocados, perfect food.
Yeah, that's perfect. Yeah, very
Perfect food.
oily.
Yeah.
Yeah. And I will probably just go a little bit into headaches and migraines, because I know a lot of people suffer. I would say suffer, because it is, for me, that's suffering, because if I have a little
Mm-hmm.
small headache that is really annoying me and I can't work, and that's like small headache. I never really had migraine. That means I can't probably even imagine that. Do you have any connections between migraines or food or sleeping or breathing, or any kind of idea or research done around that?
Oh yeah, for sure. Oh my God, there's actually a tremendous amount of research on that.
Yeah, let's
So,
do it.
so the most common type of headache is a tension type headache, right? Those are the ones you feel like right here and the sides. So that is caused by the greater auricular, and greater orbital nerve being pinched between C2, your second
Yes, yeah.
cervical, and the base of your skull.
I can feel it sometimes when I can actually, only headache that I have is usually, it feels like it's from muscles, like it feels like
That's right.
muscle pain. Yeah, yeah,
That's
okay.
right. And it
That's
can
what it is.
sometimes refer to the front,
Yeah,
right?
yeah,
Yeah. So that's a classic tension type headache. And we know it's that because uh, when chiropractors do a cervical adjustment, they'll have instant improvement in their tension type headache, right?
yeah.
But then what happens is they go home and they clench their teeth again. And when we clench our teeth, we don't just clench here, we clench like this, right?
Okay, whole
And
body,
it
yeah.
and it throws that cervical vertebra off again, and it causes the tension type headache to come back. Now, a migraine is what we call a centrally sensitized uh, trigeminal vascular disorder. Okay. And from my point of view, that whole big word I used, the least important aspect is the vascular part. Okay. But if you go to people that treat migraines with conventional medication, the vast majority of the time, their focus is on the vasculature. Okay. And the thing that gets me about that is that blood vessels don't have a mind of their own. Okay. They don't open and close on their own because they're happy or sad that day. Okay. A nerve has to tell them to open
To
or
open,
close.
yeah.
It just doesn't work any other way unless you've got some kind of like physical blockage in your brain, which is extremely
But you're
rare.
pumping that, yeah.
Yeah. So what centrally sensitized mean? This is important for you to know. So peripheral pain, okay, means like, you have a subluxation in your neck and your hand hurts, right? Or is numb or something. We call that peripheral pain, peripheral pathology, right?
Yeah.
Because it started here and it went
It's
down
coming
to
to
your
your hand.
arm,
Yeah.
but it's here. It's outside the brain, okay? Central sensitization is when we have a peripheral problem that goes on for so long that the brain itself changes. It goes through physical changes, plastic changes, and causes other parts of the body to either hurt or go into malfunction until you fix the peripheral part, typically.
Okay.
Does that make sense? So,
Absolutely. Yeah. But
so, so another way of thinking about it, we believe it's evolutionary, right? We believe that the purpose one of the theories of central sensitization is you didn't fix the problem.
yeah.
Okay.
I mean,
So
brain
now
try to,
the brain is trying to bring attention to you by getting you to
yeah.
to deal with the problem. So migraines are centrally sensitized trigeminal disorders. Trigeminal neuralgias are, burning mouth syndrome. These are all centrally sensitized disorders,
Okay.
right?
That means,
So, but with a migraine, sure, you could have a jaw problem and a neck problem causing it, but you could have food sensitivities, you could have hormone imbalances, and even emotional issues that can lead to migraines.
yeah. Okay. That in your studies or maybe your opinion, it is something that you can get rid of. I believe that that's what you believe. Yeah. Like the migraines, you don't need to actually have them.
That's my belief. Yeah, I
Yeah.
mean, here's the thing. Uh, Genetics is thrown around a lot, right? And I actually like the first 2 years of dental school are very similar to the first 2 years of med school. And it was one morning, I don't know if it was pathology or something else. One of the instructors was a physician, and he was explaining, and I raised my hand and I said, "So let me ask you something. When we don't know the cause of something, do we just call it genetics or stress?" And he goes,
Absolutely.
uh, uh, yeah. And I raised my hand again. He goes, yeah. I go, that's bullshit.
Yeah.
Okay. I go, that's not a cause. I mean, genetics and stress do cause disease, but those are very general terms, right? So, for example, let's just say hypothetically, someone had a chronic TMJ problem that caused central sensitization of the trigeminal ganglion, and they got either a migraine, trigeminal neuralgia, or burning mouth syndrome. The part that determines which one they get is genetic.
Okay.
That's your hardware that will determine that.
Okay.
Okay. But the stress is coming from the jaw, right? And you need to stop that, you need to prevent that, you need to do something to correct it, in my point of view.
Interesting. Okay. That means in general, because I was surprised, like when I talked to you, like that was when I mentioned my sister, like for example, she has really bad headaches, and she has it from childhood, basically from puberty, or I think it was kind of like 15. Hmm.
Puberty, right? You hit the nose on
Emotional
the head.
stuff.
Well, it could be emotional. It could be what's called overwhelm.
Mm-hmm.
Okay. But when you say puberty, we're talking about a hormone shift,
Yes. Yeah.
right? So typically people who get what's called menstrual migraines will get the onset of the migraine right before they get their period. Okay. This is very, very obvious. And uh, I should tell you this, uh, neurologists who are the experts in treating headaches do not, the vast majority, I'm sure there's some ones out there that do, but the vast majority of neurologists and headache specialists do not actually focus on resolving or balancing the hormones on someone that's got menstrual migraines. Their methodology is, well, let's manage the symptoms with drugs,
Yeah.
like, you know.
Yeah. Yeah. She's
uh,
on a lot of drugs. Exactly. And I think that's, I just don't want to even think about it because I think that's the worst what we can do. Just go straight away into
it's not,
drugs.
it's, well, it's not the worst thing we can do, but it's a good resource to have. When I prescribe drugs, it's because I'm trying to figure out what's going on with the person. Are
Yeah.
they responding to membrane stabilizers? Are they responding to anti-inflammatories? Are they responding to a diet change? What are they responding to? Which is helpful.
Yeah.
And if I don't know what's going on with the patient, the medications are a good go-between until we can figure out what's going on. Okay. I don't want to put them on medications for the rest of my life.
Yeah. I think
I
I was talking about medication, like, where you talking about almost antidepressants, and you're talking
mm,
about medications, they should, get rid of the pain, calm you down, and all that stuff. I think that's a little bit wrong because you going a little bit too, I guess, too far with medications. I understand when you say, you try anti-inflammatory, you try food, you try a few different things,
yeah.
but being, forever on, I don't know, Xanax or something else, I don't know, like, I don't know all the names of medications, I never use them, but when you are on them, I think that's, yeah, I feel like I shouldn't probably talk about that because that's, for me, like, that's the shady, dark place.
Well, it can be, but it doesn't necessarily have to be.
Yeah.
Um, part of the problem is physicians don't have training on how to fix diseases.
Yeah.
Okay, they have excellent training on diagnosing, like doing an MRI, a CT, a blood
Yes.
test to find out what's going on. But then the treatment is often some kind of pharmaceutical uh, drug to pacify the symptoms, to reduce the patient's symptomology. Or if it's not good enough, they'll look for a surgery they can do. They're usually amputating something. So a functional based person, a functional physician, a naturopath, a Chinese medical doctor, a chiropractor that's more focused on the functional aspect of why we got it to begin with is going to focus on, okay, well, let's see if we can find out a root cause to this. Let's see if we can find out. And then let's hope that what I do for you doesn't make it worse. So, for example, we know that medications like Xanax actually causes people to clench their teeth more.
Okay.
Right? It reduces REM sleep, which is what we need for emotional processing, and it causes our patients to clench their teeth. Well, if the reason you're having a tension type headache is because you're clenching your teeth, taking this medication is going to exacerbate that, right? But at the same time, if someone is dealing with a PTSD, someone is dealing with a breakup, someone is dealing with a loss of a loved one, they need help. They need help.
Yeah.
And I hate to say it, I don't recommend drugs as the first line of treatment, but at the same, it's not my field. But at the same time, if someone sits there and says, "I cannot cope with what is happening," okay,
Yeah.
it's something that you can offer to see if you can bring them down.
I think that's again why all the industry of coaching and NLP, came out, because we are actually helping people with trauma. That means you don't need to actually go on medication. You can reduce
Well,
the trauma. Of course, you need to deal with that. Like, we basically teach people to deal with that, because when you suppress.
What do you do? What do you do to deal with PTSD?
I don't have people or clients with PTSD. I was more talking about the loss of someone, like or just going through traumas, going through hardship in their life. Because sometimes it is, a few different changes. It can be hormonal changes going with the trauma. There's a few different things, and there's a lot of NLP techniques. There's a lot of trauma release, and anchoring and making only like when you think about session, when you have session every week with someone and you make them feel great on that
Mm-hmm.
session, they can take it with them. They can actually practice the some NLP practice every day. They can do it
Mm-hmm.
for themselves.
Mm-hmm.
I'm not saying it is it's more about don't suppress or don't prolong that suffering, because sometimes medications make you, calmer and make you feel better because you don't have that strong emotions,
Mm-hmm.
but it takes longer time and you need to be a long time on medications. But when you're dealing with that, I believe it's making that process a little bit different, a little
Mm-hmm.
bit probably shorter, and also you can avoid that long time on medication and have the, other things, because I believe all medications causes are something, there are side effects,
Oh yeah.
there are things that are happening we don't want in our life,
You
and
know, that's kind of the expression we have here in the States is we'll say if you're taking a medication to fix a problem, okay, you are now healing from two things instead of one. You're first healing from the problem, and then you're healing from the medication later, right? So, in the context of sleep, I always say that sleep is more important than diet and exercise put together, okay? And I don't mean to say this facetiously. We get almost 100% of our growth hormone from one stage of sleep. We get all of our mental emotional processing during REM,
yeah,
okay? And we have countless studies on, we wrap things like depression and anxiety into one word called psychosocial disorders, okay? And there are so many research studies where they correlate the severity of someone's depression or someone's anxiety, and they'll do sleep studies on them, and their sleep apnea is one-to-one related, meaning the more severe their depression, the more severe their apnea, okay? And now in separate studies, we've on patients who are tolerant to CPAP or patients who are tolerant to the oral appliances that are successfully treating sleep apnea, we see a reduction or a resolution in these psychosocial issues when the sleep apnea is resolved.
this is
We
yeah,
we see it all the time.
yeah. This is such a huge topic because even if you will go to anxiety or depression, I was actually thinking about something what happened because I couldn't sleep one part of my life. Like I had really hard time to sleep, and it was actually caused by kind of stress because we like had the burglars coming out trying to go into the house, and
Wow.
after 4 times that happened, they never came in, but there was like broken doors, or they steal some stuff around the house, and it was very strange. But that stress and that fear was causing me to create a stories and vision around like, okay, what I would
Mm.
do when they will actually come in. And when I was alone during the nights, when I was with my partner, that was fine, but when I was alone, I couldn't sleep. Every sound, wind, whatever it was,
Mm.
woke me up,
Yeah.
caused huge anxiety. My heart was like, after 30 kilometers run, like I just felt like I'm so awake, and I couldn't calm myself down. Then I realized, because I'm working a lot with thoughts and that neuroscience part, like we can actually change the thoughts, change the story, and change this physiology with what we do and how we feel. And that was the only thing that helped me. It took me so long. Do you have anything around that, like what you would like to say? Because I think that's big topic again.
Well, okay. So to me, what you're describing is PTSD.
Okay.
That is PTSD. So, for example, when we had our Vietnam veterans come back, okay, one of the things that was very stressful for them is they would be in a covered truck. They would like
Yeah.
all the soldiers are in the back, they're covered, and the person in front is always looking to see if there's a bomb on the road or if it's an ambush. Okay. And so when the bus would come to a stop, some soldiers would be stressed out of their mind. Am I going to die right now? Is a bomb going to blow me up right now? Right? Because they didn't know. And then, they would go on after they checked and there was no bombs. Now, what we found here in LA, I don't know if you have it in Perth, but we have a traffic problem.
I didn't
We
know
have a
about.
major traffic problem the worst in the whole country. We have the 330 million people, and we have the worst traffic in the country. And a lot of these Vietnam veterans were having traumatic episodes when the freeway would come to a stop.
Oh wow, okay. Makes sense. Yeah,
and
absolutely.
and they would have a flashback of when they were stuck, and they would have panic attacks, and they would freak out, and some of them would get into a fight, and they were, it was PTSD. What you described to me is PTSD. So they have a lot of treatments for that. um, with sleep, what's interesting with sleep apnea, which is my field of expertise, is sometimes the apneic episode becomes the PTSD. Meaning someone will fall asleep, and let's say at 3:30 in the morning, hypothetically, they wake up. Oh, they capture their breath, right? Because they've been holding their breath, they've been choking while they were unconscious. Okay. The brain, as you know, high stressful moments go into our unconscious. Yeah. So what ends up happening is the brain makes a mental note that at 3:30 in the morning we were choking to death. This is bad, right? So until that's resolved, the person can have a PTSD where they wake up every morning at 3:30, and it takes them a long time to go back to sleep, where they don't go back to sleep, mainly because they had a very scary episode of choking in the middle of the night, and it created a PTSD.
Yeah.
Right? This complicates treatment, but it's a very important aspect of it.
This is, yeah, wow. This is, I I can feel when we're talking about that. Like I can feel how I felt because I know it took me really long time. But yeah, I'm not sure. Like I never diagnosed this myself. I did never really said what it is, but I know it was some kind of stress and trauma, like something that was actually coming back to me. And it's just so interesting what you're saying, because I was at the stage like, you look, I need to sleep because I know I'm destroying my health.
Yeah.
I'm actually not functioning, and I'm
Mm.
functioning basically all day plus all night because I can't sleep. And after 5 days, you're like zombie. And there's, Saturday, Sunday when you can sleep finally because somebody's at home. And you're like, yes, I can sleep.
Mm-hmm.
And but you can't really catch on the sleep because you're going down all the time. It's kind of like, like you don't sleep, you try to have 1-2 days you sleep, but you're going down because you're more and more tired,
Yeah.
and your body just can't handle anymore. And I think that was my point when I was like, okay, I need to change something and I need to find out how. And I tried to change through my thoughts and breathing, my physiology, and I can do it now, and I feel great. I can sleep, and when that happens, when I woke up or some sounds, I can hear something, I don't think about that because I know what I should think about. Rather,
Mm-hmm.
it's very interesting, and I think that's another, maybe in another part, we can talk about anxiety, and maybe we can have another episode around this, because I
Okay.
think it's big thing. I believe a lot of people have anxiety, and a lot of
It's a
people
big problem.
call, yeah, and a lot of people maybe call even depression, like, or anxiety, depression. If you're going, it's normal now. It's really normal to talk about depressions and anxiety. That means I will be happy to invite you to another episode and talk about it sometimes later, because I think it's very, very big
Sure.
issue in the world.
Sure.
Yeah, thank you very much. Do you have anything you would like to share at the end? Just tell people maybe some advice or benefits or something they can do around sleeping or feeling
So,
better.
so the biggest aspect of sleep is making sure you're getting 8 hours or more at night if you can. Sleeping, we have a thing called sleep hygiene. And what sleep hygiene is what you're doing on a regular basis for your sleep. So, first of all, regular. It has to be do the same sleep pattern every single night, whether you're working or you're on holiday. Okay. Make sure that your bedroom is only used for sleeping and sex, nothing else. Don't eat in bed. Don't do your work on your laptop in bed. Leave your bedroom as a sacred place for sleeping and sex only. Okay.
Yeah, I agree.
Uh, Diet, you want to avoid anti-inflammatory foods. The big ones in America are gluten, dairy, soy, and corn. But there are IgG4 blood tests where you can find out which foods are the ones that are going to bother you.
Yeah.
Um, if you have snoring or sleep apnea, getting a sleep study is incredibly important. Incredibly. If
Yeah.
there's a long wait to get an in-lab study, try to push to get a home sleep study. You
Yeah.
know, try to
Okay.
focus on the home. Yeah.
I love that.
Um,
I'm going to
yeah,
try it for sure.
yeah. It's so important. You'll be impressed. I will tell you this: there is no blood test that gives you amount information that a sleep study does.
Wow.
Okay.
Awesome.
You have to realize in an in-lab sleep study, we're looking at 20 different things: brain waves, breathing, muscle activity, limb activity, heart activity, autonomic nervous system activity. And for whatever number of hours you're asleep. So 8 hours of 20 leads of data. I mean, that's a lot of data, right? So those are my thoughts. If you know you clench your teeth, go to like a TMJ specialist, a TMJ expert to help. We have a website called tmjtherapycenter.com, and center is spelled the way you guys spell it, not the way we spell it. So CENTRE. So tmjtherapycenter.com. And I think in Australia, we have like 6 centers, right? We have over 65 centers throughout the world, but
Awesome. Yeah.
6 of them are in Australia. We have one in New Zealand, and
Yeah.
one of them is in Perth, where you are.
That's great. What I will do for our audience, like I will share all your information. I will share even like where is the center that you recommend, or what do you
Mhm.
think they can go, and how they can connect with you, of course. And also, I will probably ask everyone here who is listening if you have any questions for next time, or if you have anything that you would like to ask, or maybe give us an idea about topic or where you want to us to go maybe later on. And yeah, I would love to definitely have you again, and this was absolutely amazing, and I can talk and ask you a million questions about sleeping diseases and Chinese medicine, and I think we didn't even start
We didn't even
our
get into the
conversation.
Chinese
Yeah,
medicine.
I
Yeah.
know. that's
Well, I would
that,
be delighted to. I would be
yeah.
delighted to.
No, this was amazing. I think it was really a lot of information, and it was very useful for a lot of people, probably because I believe that is big problem. Like we have
Mm.
all troubles with our busyness and stress and all that what is going on in the world, with sleeping and other diseases that we mentioned today. And yeah, absolute pleasure to have you. And I really would love to invite you again and talk about it, about Chinese medicine a little bit more, and talk about
Okay.
anxiety, depressions, and maybe how we can help
Mm.
ourselves next time. Thank you very much.
It
Thank you,
would be
David.
my pleasure. Thank you so much for having me, and thank you for being like such a great host and asking such great and important topics.
Thank you very much. Okay, have a lovely day.
Yeah,
Bye.
you too. Love you. Bye bye.